Hey guys, this is Doug at Shoreline Physical Therapy with Lisa.
Hi.
She's a runner and also a student intern with us. We've been getting a lot of questions, comments about the Alter G. You may have heard of it, that it's new to Wilmington, and so we want to do a little demo video just to let everyone see how do we get a patient set up in the Alter G, what does that look like. So first step in getting someone in the Alter G is they get to wear some cool shorts.
Woo!
So Lisa's going to throw these shorts on. They're fitted, so there's different sizes for everybody. What size are hers, Steve?
They're a quadruple extra large.
That's unfortunate.
And they're still tight.
All right, she's working on
Snug.
it. So she'll get the shorts on, and then she'll get her shoes back on. You see it's got a zipper, a big loop around it, and you'll see how that works in the Alter G once we get her in there and how it gets her into this air chamber that actually unweights a person when they're running or walking. A lot of applications for this. Elderly people with balance problems or endurance problems do well. People that are trying to lose weight that need that unweighting to be able to walk and exercise, it does well. Runners looking for a recovery run, people with lower extremity injuries that can't run or walk full body weight, we can get their body weight down to where they can walk or run sooner than any other therapy clinic in town. So once she's ready, are you set?
I'm set.
This bag comes down, she hops in, and then we bring her back up. You were 7, right? So this is what the zippers are for. She gets into this chamber. Got it. And she can get all the way around. You're pretty much going to zip yourself into this thing. She's stuck in here. What do we do now, Steve?
Pull the fire alarm.
Let's do it. All right. Anyway, we're going to calibrate her. That's a bad joke. We're going to calibrate her body weight. So there's weight sensors in the bottom of this treadmill, and they can determine how much we can unweight her for this session. So to do that, you just hit start session. To calibrate, cross arms, don't move. Don't. You'll see the bag fill up, and then we'll get a zoom in. You'll actually be able to see her lifting off the treadmill as she gets calibrated. Are you lifting yet? You see her heels coming up. Don't hit. Alright, so she's calibrated and she is ready to run. So once we're ready to roll, we'll just start a session with her. Want to zoom in here?
Yep.
So the screen gives you some options. She's at full 100% body weight right now. Just for fun, we'll take her down to 70% of her body weight. She's warmed up, right?
Let's hope so. Are we gonna do it?
7. We're going with 7.
I can do 4.
We'll get you up a little faster. So this will tell us kind of where she's at on her unloading and her speed. We can put some analytics on here. So as someone's walking or running, we can look exactly to see is there any asymmetry, how their weight bearing, how their stride length is, what their cadence is when they're running. So it gives them feedback on if they have a lower body injury, say a right leg problem, is the right leg doing anything different than the left leg? We also have video capability, so from the front you can look and see how does she strike when she runs. Is there any differences or obvious asymmetries right to left when she's running? Two main things we look at. The other cool thing is that anytime a patient's on here, if they're at a certain weight bearing or speed, they can rate if they're having any lower body pain. So if she was having, she'd say 3 out of 10, you just hit the 3 and it'll record what your pain level was. We want to get their weight down and speed to a point where they can hit 0, where they say I'm fully pain free at this point. Alright, so we're gonna, just for fun, have her go quite low in her body weight. And right away you can hear that she's not hitting the treadmill so hard. And the cool thing about less body weight, you can go faster. Are you ready to go fast? Alright, so at least you're gonna go fast. She has a really efficient, smooth gait, so it looks like she's just kind of floating on that treadmill right now, and she really is because she's unweighted by about 50%. How's it feel there?
Yeah.
So now she's really she's at 40% of her body weight right there. Again, you can hardly hear her hitting the treadmill.
Do you feel like an astronaut, Lisa?
Run in space.
The cool thing is, even at that low a body weight, if you get that speed up, how will you like speed?
My legs were gas.
Her heart rate's up, she's breathing a little heavy, so even in that short run, you still get the benefit of the workout without the load on your joints. Here, come back down to earth.
Still awake.
So now she's back to full body weight at this point, and it happens that quickly. It automatically adjusts her right away, which is cool. Obviously that's a shortened session, but you kind of get the idea of the unweighting effect, the capabilities, and what we can look at. How'd you like it?
I love it. It's tiring, but it's so much easier on your body than it is like run on pavement or a treadmill.
She's not paid to say that word. All right,
I'm
how's
not
it?
working for Nike. Whew.
Options here is if a patient gets a report, they can create a report so they get a full report of their speed, their unweighting, their pain levels. They can get it to a thumb drive they can use, or they can send an email to themselves. We won't put Lisa's email on here, so you all can't contact
No
her.
spam.
Sorry, no spam. And then once we would do that, you just exit the session, hit OK, and then she's done with that session. Then you just unlock this, bring that down,
Now I just come back down to earth.
and she steps out of that, and she's done. So that's the Ultra G in a nutshell. It's been valuable to a lot of patients so far. We're excited to have it. If you're interested in using it, have any questions about it, feel free to contact us through email or call our office. Thanks, Lisa.